Well, after surviving a stroke, at first you feel a lot of relief, but then you realize that life has changed. This morning we're talking about how to adjust to this new normal, and we're joined by Millikan. She's a nurse practitioner at Guilford Neurologic Associates and a member of the Cone Health Medical Group. Good morning.
Thank you.
First off, let's talk about what happens during a stroke, what you need to recover from.
Well, often during a stroke, you can be left with certain deficits. So you can have a weak right or left side, or you may even have trouble speaking after a stroke.
So after that, we talk about the new normal. For a lot of people, you hope things would be the same, but people are going to deal with, as you said, a deficit in some area, right?
That's right. And so oftentimes we want to help them go back to a new normalcy and create some independence for them. So we often refer to physical therapy, occupational therapy, or speech therapy to get them that extra help to help them regain that independence that they used to have.
So a stroke is going to affect different people in different ways. You mentioned mobility being one of those, or speech or something like that. There's no real template for what you're going to have to deal with.
That's right. It's all dependent on where the stroke occurs in the brain as to what deficit you may or may not have.
What about family members when there's a new normal for them too?
Oh, absolutely. They may take on the role of a caregiver after someone has a stroke, and so they need that extra support and resources to help them cope with their new normal.
For some people, it's going to be a temporary role. For some people, it's going to be long term. And again, it's hard to predict who's going to find themselves in which situation.
That's right, and oftentimes what we want to do is try to minimize the risk factors for them having another stroke. That's, for most of our patients, that is their number one concern. Am I going to have another stroke?
And how often does that happen where something will kind of repeat again?
It's hard to predict, but what we want to do is manage the risk factors. So if we modify risk factors, we can definitely minimize the way that they may have another stroke.
We've got some of them up on the screen right now, talking about blood pressure, cholesterol, blood sugar, and things like that. Things that doctors would tell all of us to do, but how critical is it after you've had a stroke? Are you more at risk? Is that a greater reason to make those changes?
Oh, absolutely. It's detrimental that we manage their risk factors. If we let their blood pressure, their cholesterol, or diabetes run out of control, that definitely increases the risk of them potentially having another stroke.
Oh, on the flip side of this, what about success stories? Where I gather you have seen people who have been in tough shape, all of a sudden make great strides by making those changes and trying to go through rehab and do everything they should.
Oh, I've seen patients when they come first into the office and they can barely walk, and we do a little physical therapy. We help them with their risk factors. By the next time I see them, they're almost independent again.
Oh, wow. I mean, it's amazing. And that's the thing that I guess that drives a lot of people. Again, that's not going to be for everybody, but it does happen and it does work, doesn't it?
Oh, absolutely.
What are the things that if you have to advise somebody, they say, I never want to find myself there, I want to do what I can, what would you tell people to do as far as changing your life to avoid having a stroke?
Well, just a healthy lifestyle. I mean, you need regular checkups with your primary care provider to make sure you're not running the risk of high blood pressure, high cholesterol, or diabetes. But then certainly maintaining a healthy diet, exercising regularly, and certainly if you're a smoker, I would suggest to consider quitting, and your provider can help you do that.
Some great advice. Thank you so much.
Thank you for having me.
And again, the new normal can actually be a good outcome for you just by following those right there. Cone Health, by the way, offers several different support groups. They can help in turn. In Guilford County, there's a group that meets on the second Thursday of each month between September and May from 3 to 4 p.m. at Moses Cone Hospital. Alamance County, they've got a group too. The next stroke support group will meet on March 19th, 12:15 to 1:30 at Alamance Regional. Find out more by giving them a call at 336-538-7500. There's also a brain injury and stroke support group in Reedsville, third Monday of each month from 1:30 to 2:30 at the Leaf Adult Day Care Center.
House Call on Fox 8 is sponsored by Cone Health.